Everyone, welcome to the March 2024 edition of the Appalachian Diabetes Coalition Network, our office hours. And today we have our two fantastic speakers from the Lake Cumberland Health District and my colleague and friend, Regina Knox with Marshall University. And these fine ladies, I'm going to let them introduce themselves, and they're going to be discussing the National Diabetes Prevention Program and how they do it there in the Lake Cumberland Health District. And then Regina will do a quick intro and information session about how you can be part of the Umbrella Hub, and we'll talk more about that after Vicki and Jennifer get a chance to present.
My name is Vicki Albertson. I'm with Lake Cumberland District Health Department. Our program is the Wellness Outreach and Education Program, and our primary focus is on diabetes education and the prevention of diabetes. So that's the Diabetes Prevention Program. And I'll let you introduce.
I'm Jennifer Dixon. I'm a registered nurse and certified diabetes educator in their program.
And I'm also RN certified diabetes educator. I always forget to mention that part, but me too. But well, I'm going to share my screen then, and we'll go ahead and get started on that. So.
All right. Thank you, Vicki.
And we also have
I'm sorry, Vicki. If you guys would be so kind, if you haven't already done so, just put in the chat box your name, county, and state, and the organization that you represent. And if you have any questions, Vicki, I guess it's okay if they just kind of raise their hand or stop you at whenever they want to, or you can put it in the chat box, and then I'll grab their attention and ask the question for you. All right, ladies.
Also, I should mention that Amber that's on here, she's also part of our team. She's our community health worker, but she is also a lifestyle coach for the Diabetes Prevention Program. So Amy Huff, she's not on here today. Amber, Jennifer, and myself, we're all lifestyle coaches for the Diabetes Prevention Program here at Lake Cumberland District Health Department. Let me find my little slides here and proceed on. Our program is called the Life Change Diabetes Prevention Program. And so what that stands for is the Life Change is an acronym, because Jamie Lee, she was the one that came up with that, and she loved acronyms for sure. But living intentionally, fully engaged, choosing healthier activities, nutrition goals, and exercise. So we wanted it to stand for something, and so you know, we believe, you know, that these are things that we can do with this program. So just a little overview, just in case you're not familiar with it, how the Diabetes Prevention Program works. For the CDC, they put out these requirements. So they have to meet all four of these. They have to be 18 years or older. Their body mass index has to be 25 or higher, 23 if it's Asian American. They cannot be previously diagnosed with type 1 or type 2 diabetes, and they cannot be pregnant. So they have to meet all four of those. But they also have to meet one of the following requirements, one of these. So if they've had a blood test, you know, like they may have had their hemoglobin A1C that was 5.7 to 6.4, or if they had had a fasting blood sugar that was 100 to 125, or if they may have done the glucose tolerance test, and that's where you had to drink that real sugary drink, and then you wait for a couple hours, and it would need to be 140 to 199. Or if they had been told that they had previously been diagnosed with gestational diabetes. Or if they don't have any of those, there is the pre-diabetes risk test, and they have to score 5 or higher on that. And I should have put that in there, but I forgot to do that. There are different types of delivery modes for the Diabetes Prevention Program. In person, that's where obviously you meet in person with these groups. I've had several cohorts of those throughout while I've been doing the diabetes. I've done the DPP since about 2014, and I'd had several of those in-person cohorts. The distance, that means that the group meets by like Zoom, for instance, Skype, it can be Facebook Live. I've got a little asterisk there by the Zoom because our Zoom is HIPAA compliant. So if your Zoom isn't, HIPAA compliant, or you may need to check on that, or, talk to somebody at your organization to see if that, because, we don't want to break any HIPAA. So that's what distance learning is. The online, which a lot of people get distance and online mixed up because it sounds like it's the same thing, but the online would be by an app. And we're going to talk a little bit about our app that we're using this year. And then the other way is combination, and it's a combination of two of these. I want to just talk a little bit about how I set up when I done the Zoom, because I've also done the Zoom during COVID. We had our distance learning for the diabetes prevention program. I had a live cohort or in-person cohort going on right as COVID hit, and so we were almost done, and so I had to do a lot of different things trying to finish up my cohort. So my next one was by Zoom. And so whenever we set up our Zoom meetings, of course, again, you want to be HIPAA compliant with that. We have our eyeball camera. I don't have that, and we're not using that today, but that eyeball camera is really, I think it's a lot handy to have, as far as trying to teach class and stuff. I have down at the bottom, you can see where I had the 2 monitors set up, and that's real handy if you're doing that, the distance learning like that, because you can see your participants and their reactions, plus you can see your, what you're showing them, plus your notes on there. And I was telling her to remind me to tell you, we always have like a tablet or a phone or something, so we can see when you're sharing your screen, making sure what they're seeing is what you're seeing. And so we always try to do that as well. Is there anything else I needed on that?
That's all I got on this one.
Okay, I'll let you go ahead.
Okay, this is our app format that we use, or our platform. It's called Living Healthy Kentucky Lifestyle Change Program. The app is downloaded on to an iPad and or a phone. They can go in on the desktop and just type in the link and get to their information that way.
I'm going to try to share.
She's going to try to share hers.
So I'm going to stop and I'm going to stop and try to get back to, okay.
Okay, this.
Wait, yep, let me get back over here. Yep, that's it. Okay, can y'all see my screen now?
Yes.
Okay.
Okay, this is kind of what this is what the app looks like. And this is the dashboard, and they can go in here and every week they are sent a little video. The videos are no more than maybe 10 minutes long. I think it's the longest one that I have watched. And Vicky's going to show you how they just go in and click on it once it's sent to them that week.
And so down here at the bottom are the different ones. And this was our test page, so I've not done all those, but let me scoot back up here. So it'll show the different, it'll go through there, but it also has the lesson documents that you can access on there. And so they have that, and they can print those off or download those onto their computer. So they have that as well. Let me go back to this page then.
And this is a year-long program. It's 26 weeks. Weeks 1 through 15 they are sent the video every week. And then we also send them, and she'll show you in a few minutes, some PDFs and different things of healthy snacks. The one I just sent her this morning was being physically active without spending a dime. So some questions we get, I don't have the money to afford a gym. So we reach out to them quite often. At least we try once a week, plus they're sent that video. Then on week 16 and 17, those are bi-weekly. So every other week they will get that. And then from 18 to 25, it's once a month. So we send it to them once a month. And then on week 26, that's just kind of the final part of it. we reach out to them. You can email the PDFs, you can send all of that through here. And we just, sometimes we'll put in a message, just checking, this is Jennifer and Amy. Amy does it with me. And we'll say, do you have any questions or concerns? Is there anything you need to know about? And that's just kind of how we do the program. They're able to take pictures of what they eat. She's showing that now. And we can view that. And then we always try to give them positive feedback. We try not to give them anything negative. It's a struggle enough to try to eat healthy and lose weight. So we try to encourage them, or we may send them a PDF that talks more about, you know, a healthy recipe or something like that.
Hey, I have a question.
Mhm.
Now this is just for your distance learning?
This one is the
Yes.
online
This is
through
the
the
online.
app.
Okay,
Yeah.
okay.
Yeah.
And was this app, did you guys develop this yourselves, or this
No.
is part of a Kentucky
It's the HALT
statewide program?
platform.
Yeah, our KDPCP, they were kind enough to pay for this for the app for us this year, and it's based on a HALT platform. So I don't know that we'll have that next year or not. We just knew that we would have it at least this one year. So it can be really convenient. We did have some issues to begin with that hopefully has been straightened out at this point. But and that was that did cause some issues for some folks that were trying to use the app. So but we don't know if that's something that will continue to be offered to us or not at this point. So, but we knew we had this one shot at it, so we took that shot.
Great, thank you.
So, but it can be a good thing. You can connect your like your Fitbit to
Yes.
that, and so that's handy, you know, for people to upload their activity minutes. They can do their weight. They can do like their blood pressures, their blood glucose. There's the community that they can connect with in there as well. And then it has your timeline. So there's some information, you know, it's easy to access with that. So, okay. Does anybody have any questions? I'm going to go out of this if no questions.
And you said that was the HALT?
HALT platform,
platform.
HALT.
Okay. Thank you.
And then let me go back to my PowerPoint. Oops, what's that? Let me find my little button there. So that was just an example of what that is. So it has this information on there, like my start date, what my weight and height would have been, my BMI and all that. And I've not got all that filled out on here, but it will graph that for the participant, but it also helps the coaches see that as well. So the positive side of the lineup or the online DPP, you want to go over?
Lifestyle coaches can speak with the participants daily, and that's what I was saying on that one. We can send them messages every day. We can reach out to them with questions or concerns, either individually or as a group. So depending on what we're sending or what we're seeing them send us back, you know, we like to keep it as confidential as possible. We can have multiple coaches for one cohort. Like I said, Amy and I are doing this together. So, you know, we kind of keep in touch. Have you sent anything out today? And just go back and forth. We have the ability to see if the participant has watched the learning videos weekly, or did they do a makeup session video. So that's really important, because if they're not watching those videos or they're not making them up, and we understand things come up, but those videos are very important to keep them motivated. So we can see that, and we can reach out to them individually and say, hey, I see you've missed a couple weeks. Is there something I can help you with? Anything like that. The program also generates reports and graphs, so that we can kind of see, and the client can see as well where they started and where they're at currently. And that's really good. That's great motivator for most of them. And then the program also lets us coach, lets the coach know about how long it's been since they have engaged with the app. So again, we're able to see, are they engaging with us? If not, reach out to them, try to find out what's going on. Is there something we can help you with? And for some of them, it just may be simply, they kind of got off from the program and they're having a hard time getting back on it. And we'll say, just jump back on and start with the videos and do your makeup videos, and then let's talk afterwards. And then the negative side of some of being on the online DPP, not all participants log their start weight, or even log their weight weekly. Even with us encouraging them and reminding them they need to do that, not only do we need to see it so we can, assess it and say, what do they need? Where do they need our help? But it also has that graph that we talked about so that they can see their progress. So that's really important. And a lot of times they don't want to do that. Participants also don't engage with the app and watch the weekly videos. They'll just disappear for weeks at a time, and it's hard to get them back into the program. Participants don't respond when the coach puts a topic up, wanting the whole group to engage. Just maybe say something about it, and it usually gets, a talk going. A lot of them will not engage in that. And we feel lost as a coach, or at least Amy and I do, and we feel sometimes like we're letting the participants down because they're not responding back to us. And so we're constantly trying to figure out what can we do differently that may help them, that will get them re-engaged and to come back on board with us. And some of them, like I said, don't respond to anything. We put it out there, we do what we can, but they have their part they've got to do as well. And then participants just don't fill in all the info. Currently, like Vicki, currently on the one we've got one young lady, and she has put everything on there, and it's so nice to see the food that she's eating and for us to be able to comment on it, what she's drinking and all that. She puts in her weight every week. She works really hard at the app, and it is showing in her numbers. And I just wish, but we can't because of HIPAA, but I wish that everyone could see the progress that she's making because she is staying with it. I think that would be a lot of encouragement to other people, but we get it. It's a HIPAA, you don't want everybody seeing all your information sometimes. So
Do they have an
there are challenges.
opportunity with the app? Do they have an opportunity to chat with each other and engage with each other?
They can on the community board.
Okay, but people aren't accessing that.
Yeah, right. And you all know, it's easier when you can see somebody and interact with them. So I know with the in-person cohorts, if you see somebody, like you can tell if you're losing them or if they're, something's going on. Sometimes you can see that. The same with the distance. Usually you can see that you have that person-to-person interaction. So the app's a little bit different. I think it does take somebody who's motivated to do that. But I feel like this diabetes prevention program, I think it can be really successful. I've seen it, throughout the years. I've had people who've been very successful with that. And so, I know it works. This is our telehealth informed consent. So we have a link. This is what we usually use, like when we're doing like our Zoom or a distance with this. We'll send that to them and they'll sign it. It's electronic and stuff. And so they'll fill that in. So we know, so we have that consent. Also, one of the things we put, whenever we do a Zoom, whether it's even DPP or if it's anything that we're doing like that, even if we did gentle yoga, and we have this notice of consent that pops up, and they have to agree to that before they can join the meeting. Was your question there, Sheila?
Yes. How much does the platform cost? I know you said that the Kentucky,
I don't
they
know
paid
because
for
we
it
get it free
this
from
year.
them.
So, okay.
I don't know how much it would cost in the if we're going to have to pay for that ourselves, I don't know. But they've footed the cost for that for us, which we're grateful for, because I
Yes.
don't know that we would have been able to had they not done that.
Right.
And I think this year for them was the first year as well, so it's kind
Mhm.
of a trial and error
Yeah.
to see if it's
Okay.
gonna work. And I mean, like Vicky said earlier, we've had some issues, especially at the beginning, but they've seemed to got them resolved, but maybe we're thinking during that time, we may have lost some participants,
Mhm.
because they were frustrated with the app on their phone. And we've not been able to get some of them back yet. So
Mhm.
again, I think it was offered free to all of us
Mhm.
this year because we're just trying it to see if it's actually gonna be something that would be feasible to do.
So they're not
Mhm.
sure, I don't think at
Yeah.
this point, whether they're for sure going to bring it back or not. So I don't know
Okay.
yet.
All right, thank you.
And that's pretty much all we had in a nutshell. So this is our contact information. You can email any of us, or you can give us a call. We've got our 800 number there. So
And Vicky, you guys cover 10 counties?
we do. We cover 10 counties. And so I was just sure we would just have people hanging out in the rafters with this app, because I thought this was so good, because when you're in a rural area, it is so hard to get into town sometimes, it's not
Mhm.
like, you live 2 blocks down, it's you live 20 miles out somewhere or something. So I was really excited. And then we struggled even to get 10 people with this app, and I was really surprised. I really truly was surprised that
Mhm.
we didn't have more. And then we didn't keep all of those folks. So
Mhm.
but it's
Did
always a
you,
learning curve.
did you do a lot of advertising?
Yes.
Okay.
Facebook.
We did social media. I know we all contacted different areas. Like we'd contact colleges, we'd contact work sites,
Mhm.
churches, whatever we could, try to get that out there. And so so I was really disappointed, because I really thought that it would take off. And that's partly because I feel like it's such a good program. And, I know some people may not like it. It is a commitment by that coach, as well as that person who's participating. But I've seen it work. I've seen people that have came off of medicines. I've seen people who couldn't walk 2 foot, and then they're, leading exercise classes. And so
Yeah,
it can make a big difference in somebody's life. And so I really believe that it's a great program.
yes. Well, thank you, ladies. Anybody have any other questions before Regina? I turn it over to her. If you think of anything, shoot us a message in the chat box.
Okay, well, good afternoon / morning for some people. Janice in Mississippi specifically. My name is Regina Knox. I work alongside Sheila, and I saw Kevin on here, but I think he jumped off. In the School of Medicine at Marshall University, the Chronic Disease Division, and we've done a longer similar information session, but today we just thought this really paired nicely the Lake Cumberland Health District's presentation about their experience implementing the National DPP. So we're just going to revisit it. If you have any questions throughout this section of the webinar, please feel free to raise your hand or interrupt me or put it in the chat box. But we're specifically going to talk about the Marshall University Umbrella Hub. And that's what we're going to talk about. So what is an umbrella hub arrangement? It's really a system that the CDC came up with to provide funding to smaller community-based organizations like the Lake Cumberland District Health Department, who are implementing the National DPP, but don't really have a sustainable way to fund the program. Typically, when National DPPs first started, they were mostly grant funded. They're run by volunteers or employees at a health department or a healthcare facility. So for those smaller, specifically coalitions who have volunteers, it's hard to maintain, especially if you have volunteers who are dedicating, 12 months of their time, their personal time, to help, their fellow community members. Also, there are other costs associated with implementing the program. For example, Vicki talked about the HALT program, and although they got grant funding for it this year, it may be a significant cost in the future if they want to keep that program. Or supplies and materials, Zoom has a cost to it. The free subscription is only like 45 minutes, so that you really wouldn't be able to use the free Zoom for this particular program, because it has to be, we prefer that it be HIPAA compliant. So you'd have some costs even if you're trying to, do it via distance learning. If you're doing it in person, there's other costs like the manuals, the modules that you would supply to your participants. I know every lifestyle coach wants to give some type of reward or incentive to their participants, so that may be an added cost. So it's not a no-cost program by any means. So smaller community-based organizations would need a way to fund this program long-term. So this is what the CDC came up with. It's where you have a larger entity who is able to bill health insurance companies on behalf of that smaller entity so they can get reimbursement for offering the National DPP. So they work really closely with Medicare. There are some Medicaid programs cover it. Various employers cover this under their benefits package. So you can get reimbursement for offering that program. And I'll talk a little bit more about how the reimbursement works in a minute. So you have the UHO, which that's us, that larger entity that is able to do all the billing, all the administrative work. So we would be submitting the claims on behalf of the lifestyle coach or the organization that the lifestyle coach works for. We use a platform called Weld, where the lifestyle coach enters all of the information, the participant, their weekly logs or weight. So they're doing all the data entry. So they don't have to worry about, keeping paper copies. So we can see all the information they're entering into the platform. The platform actually auto-generates claims and sends that claim directly to whatever health insurance provider. So it's really a streamlined process for us. We do have access to billing experts because we implement this program in partnership with Marshall Health. So it's a partnership between the academic division, which we're in the School of Family Medicine, and Marshall Health, which is a healthcare center side. So we partnered together to implement the hub. And then you have the subsidiaries, which are those community-based coalitions. They are really doing all of the work. So if you don't implement the program, you really can't bill for it. So they're the boots on the ground. Everything really starts from the lifestyle coach level. So they're, reaching out to participants, recruiting participants, entering their data, encouraging them to meet those performance measures, which are attending class, achieving their 5% weight loss, and increasing their level of physical activity. And then I already talked about the billing platform that we use, that is Weld. So our business model and other umbrella hubs have similar models, is that we're going to start from the bottom where we have our subsidiaries. So right now we have 4 subsidiaries, and they're all basically in different states. So we're very happy that we're able to partner with Lawrence County Health Department in Kentucky, Healthier Community Coalition of Southwest Virginia, Cold Grove Pharmacy, which they actually serve 3 states, Ohio, Kentucky, and West Virginia, and then Stork's Nest, most recently via the Macon County Diabetes Coalition in Tuskegee, Alabama. So we have our coalitions implementing the class. They are working with us through Weld to submit claims, and then those claims are submitted to payers, whether it's Medicare, Medicaid, Medicare Advantage, whatever healthcare payer that their participants work with. We do administer a small fee is 20% at the hub level. So the way that works is that we will bill the healthcare insurance company on their behalf. Their reimbursement comes to the hub. We deduct the 20% and then we send a check, the 80% back to that coalition. So they're really able to get, a large percentage of the reimbursement so they can continue to sustain their program. I'll just pause there. Any questions about that? Sheila?
I'll have a question. Even though I know the answer, but this might be on folks' heads. So how much do they get reimbursed? What is that amount that typically is under the Medicare? Because right now it is Medicare. We are trying, with MCOs and we're onboarding that slowly.
Yes, that's a great question. And I'll answer that from two perspectives because the reimbursement model recently changed in 2024. So previously we were only able to bill in certain sections. So the person would go to 4 sessions, let's say, and you have to bill in consecutive order. So we get billed for session 1, but not until after they completed session 4. And then we get billed at session 9 for session 4. And then we get billed for it in the maintenance session, which is like in weeks, months 7 through 12, we get billed for 2 of those maintenance sessions. So it really was infrequent. I mean, this is a 12-month program. You're looking at getting reimbursement like every 3 months. And we know that Medicare is not really, a quick turnaround to pay out reimbursement. So that's how it used to work. So the new 2024 reimbursement changes to the physician schedule is that we will be able to bill as frequently as every 30 days. So we can get credit for, we can bill for attendance as well as meeting the 5% weight loss. So ideally, if a person came in, they're really, active, they're really doing everything they're being, directed to do, you can get as much as up to $720 per person. If they're coming to class, they're meeting their weight loss percentage goals, it's up to $720 per person. That number changes if they miss class, if they don't meet their weight loss goals, then that number changes, it gets reduced. So good question. Was I clear?
Yes.
Clear as mud, clear as mud.
You're great, Regina.
And we're still learning as the changes come online. For example, we just learned that Weld, which is our billing platform, also wants to assess a fee. So we're trying to figure out how that's going to impact. It's going to reduce the amount of reimbursement that the coalitions get. So we're trying to navigate that, or researching, other platforms, because what we don't want to do is not give coalitions enough money to be able to operate on. That's the whole purpose of this program, to be able to get money back to the coalitions who are implementing the program. So we're just trying to balance that out as we think that through. So we are currently accepting applications to join the hub. It is an application process. And we are looking for coalitions, community-based organizations, specifically nonprofits that have the capacity or the need, or they want to offer this program. They can be existing programs in their particular community, and they want a way to make it sustainable by, receiving reimbursements. So they don't have to do anything with billing. Really, all they have to do is enter their data into Well and collect insurance cards. So there's really the bare minimum on the lifestyle coaches or the organization's side. So we at the hub assume most of the responsibility for reviewing claims, working with the payers, any issues in Weld, and so we want to make it equitable and less of a hassle for the organizations that we work with, because we know everybody has 2 or 3 things they're already doing. This is just a little piece of, people's lives. We want to make sure we make it, less stressful as possible.
Yes, very seamless. And I have
Yeah.
to say too that, we do a lot, and you guys been around a long time with us. And so we do a lot of hand holding and technical assistance and trying to walk you through. You guys, it's really been a learning process for us from the get-go. And we started this when, Regina, I want
Years
to say
ago.
3.5, 4 years
Yeah.
ago.
Yeah.
Yeah, as a pilot. And we are, and we're not the only ones, okay? Because there are people in Hawaii, there's people in the north, there's people in the south that serve as a hub. Many of those are hospitals, those type of things. But this is really, I really think we're very unique. We always have been, because we're the Appalachian region. And, we're very rural and very proud people. So, but this has been our cohorts, our subsidiaries have just really been very engaged, and so we all work together, just like Vicky, like you guys in your app. You just keep doing it. And but we've come a long way. We've got 4 affiliates and or subsidiaries. And so yes, we are taking applications now on a rolling basis. Typically there's $5,000 available for subsidiaries, and we'll talk a little bit more about that, I guess. Regina, I'll turn it back over to you so we don't get tangled up.
Got it. So the application is not meant to be an in-depth, process. It's 5 pages, no more than 5 pages. And we give you some questions that we want you to answer. For example, we ask you to describe your population of focus. Who are you serving? It could be, a specific county, a specific neighborhood, a city, and then talk a little bit about some of the barriers that the people that you're serving may have. For example, barriers to care. They might be high-risk population, minorities, rural, people with disabilities. So talk a little bit about that in your application. Describe your geographic focus. For example, like I just said, the specific county, or if you serve a specific zip code or a specific community, like a senior assisted living community. We want you to describe your implementation approach. So because we want to make this program to be sustainable, how do you plan to scale up your program? We know traditionally it's hard to retain people. Attrition is about 50% nationally. So if you recruit, enroll 10 people, you're going to lose half of them. So what's the plan if we know that you want to submit reimbursements? What's the plan for getting enough participants to stay in the program so you can get enough reimbursement to keep the program going? So that's basically why we're asking that question. Describe your sustainability plan. For example, we encourage all of our coalitions to have at least 2 lifestyle coaches. Having only 1 lifestyle coach is not really sustainable, because that one person does everything. You're doing marketing. Then if you're sick, there's no one to help you take over that class. So having at least 2 lifestyle coaches to provide you with the backup person or assistance if you need it is really helpful. And then if you want to offer more classes or more cohorts, having more lifestyle coaches will give you the ability to do that. So talk about how you plan to sustain the program. And then we want to describe your efforts to address health equity barriers. And health equity barriers can be a variety of things. It could be people who, don't have transportation, people who have disabilities, people who are low income or minorities. So whatever those health equity barriers are for your particular community, we want you to talk a little bit about that. And so the application, we have it as a PDF and as a Word document. So you would just complete the basic information, a contact person, how many lifestyle coaches do you have, the anticipated number of people you want to reach. That helps us for planning purposes. Do you have a referral system? With Weld, you can connect to some EHRs. For example, if you're currently working with a healthcare provider and they want to send you referrals through their EHR, Will has the capability to do that. We haven't used that yet, but it does have the capability to do that. So what is your current referral system? Do you have a fiscal agent? For example, are you an independent nonprofit, or do you work with someone else who would handle the money part? And that's really like for our fiscal administration process. Yes, ma'am, Sheila.
Yes, I was going to ask Vicki a question, and Jennifer. Do you guys have a referral process? Do you guys work with any providers particularly or anything?
We don't have a particular referral system. I mean, we reach out to, we would reach out to like the schools and stuff and try to do that. We do some of the faith-based areas. We reach out to doctors' offices, you know, people in different, like in the community like that, to try to reach people, but we don't have a particular referral system, nothing like the EHRs or anything like that at all.
Okay, thank you.
And that's perfectly fine. Like I said, we know we have the capability to do that, but we haven't reached that point yet. But you know, in the future, research says that if you are referred by a healthcare provider, you're more likely to enroll and participate in the program. Having that bi-directional information where you can share the participants' progress with that healthcare provider, we can see the benefit in that. So we haven't gotten that far yet, but it does have the capacity to do that.
I was going to say, we did have some learning collaboratives in our state that we participated in, but we had a really independent one. So we didn't get any referrals from them, but they did set those up so that if there was a referral, we kind of had a network there, but nothing as far as like a
EHR.
Yeah, EHR or anything like that. But.
Okay, no problem. And you know, we are
Ladies.
still evolving. So just being able to send it via fax, you could do that too. There's nothing wrong with that. We know lots of, you know, providers who still take and accept, you know, referrals through secure fax. Any way you want to do it, it's up to you. We're just here to support you in making sure that you have another pathway to recruit participants. We want to know your experience implementing the National DPP, how long you've been doing it. Are you a new person? We do have, you know, one organization that would be a new provider. They've never implemented the program before, so we're working with them to get their lifestyle coaches trained. So it'll be a whole new program from the ground up. So they're joining the hub. So we're accepting new organizations and existing organizations. You don't have to previously have any experience with implementing the National DPP. And then we want to know, do you have any specific technical assistance needs that we can help address? For example, we do have Kevin on our team. He can help you with the Zoom logistics, anything related to tech. He is always available to provide his services. Well, not always, but he's available.
He makes himself available a lot. He is great.
Okay, so in addition to that no more than 5-page questions that we want you to answer, and then the contact form, we're going to ask you to develop a budget based on that $5,000 or whatever the amount of funding that we have to contribute to you joining the hub, to tell us how you're going to spend that money. And that's going to be really important when it comes to saying like your expense form on the back end, because of course we are a university. These are federal funds. They want to know what you did with the money. So we'll actually just submit a budget, but the budget can change. You know, things change, you know, as you're implementing the program. You may have to shift more money here, more money there. but you can always request a budget modification if that happens. So I don't want you to feel like it's set in stone what you put on this page. It's just the estimate of what you anticipate spending in these specific categories. So some of the categories are personnel. For example, some of your lifestyle coaches' time. Most of the coalitions have volunteers. Vicki and Janice work at the health department, so they may want to dedicate, a small percentage of their time to put it on this particular grant. Travel, if you're doing in-person meetings, travel. You know what? I forgot to remove that. That was for a meeting that we had last year. But if you have any travel expenses related to, implementation, you can put that on here. Training, for example, if you need to get new lifestyle coaches trained, you can put that on here. But I will say that we will have a master trainer. I'm going to the master training class. So if you become a part of the hub, then we can train your lifestyle coaches for free in the future. So you don't have to pay for that.
Yeah.
So you need training costs.
Regina, I have a question.
Okay, yes, ma'am.
Does the training have to be in West Virginia as you have it?
No,
Does it have to be in
no. So the lifestyle coach training, which for us will be conducted virtual. It's typically going to be a 2-day class that we do with individuals who want to become lifestyle coaches, and we'll work out the logistics on how that would happen. But it'll be a virtual training for lifestyle coaches that want to join the hub. A great question, Janice. Any program materials? For example, we do want you to include a portable scanner because you will need to scan the person's insurance card into Weld. You can scan it and give it back so you don't have that, that personal health information floating around. You scan it, it goes in the Weld. We can see it and verify if we need to go back to it for claims, issues or resolving anything. We can see that information through Weld. Weld is HIPAA compliant. And it was something else for program materials. We want you to buy a scanner if you already don't have one. Oh, some other things that we were able to get approved is those incentives. For example, pedometers, measuring cups, anything that relates to recruitment and retention of participants that will relate to nutrition or physical activity, scales, food logs, any things of that nature that would help, with class implementation. You can include that. We just ask that you put each item in the cost, so it would be a line item thing for each material that you want to request.
No gift cards though.
Yeah, no gift cards.
Yeah, unfortunately.
Right.
Yeah.
No gift cards. Technology, for example, the cost to purchase Zoom, we're going to put the annual cost on there if you want to include that as technology requests. Office supplies, for example, if you're printing manuals for an in-person class or ordering manuals, you would put that in that category. Pens. Some people use binders instead of folders because at the end of the 12 months, you have, it's a thick packet of material. And then anything in other that we didn't think of that you might, might need, but doesn't meet one of those other categories, you can put that under other. I will say that we're not the only ones that approve this budget. So our staff looks at it, and then we have to send it to our funder, who is NACDD, and they'll look at it and approve it, and then we can move forward. Yes, ma'am, Sheila.
Yes. So if in Vicki and them's case, or if say anyone who had an app that they needed to pay for, that would be part of the cost as well that we could approve, because that's under that other and technology.
Absolutely.
Yeah.
Okay, so this is the budget or final report that we will actually submit at the end of the funding period, which unfortunately is going to be short. So this grant ends in July. in the end of July.
July, I
So-
think, yes.
Don't worry about the time frame. We've been doing this for 3 years. So the goal is that even though our funding period ends at the end of July, we're just going to keep going with the hope that we can, get you up and running, become a part of the hub, and to get those reimbursements coming in and back out to you so you can sustain your program. But for our funder, they want to know what did you actually spend the money on. So you don't have to submit receipts or anything. You just put, like if you allocated, $1,000 for personnel, but you really didn't need it. You only spent $750. You put that there. So it's like what you estimated you would spend and what you actually spent. So that would go on this form. And we can always help you, or Rachel, she's our new grants manager. She can always help you with completing this form. So the deliverables, what are we asking you to do as a part of Join the Hub? We want your lifestyle coaches to register with the to get a national provider identification number. It's free, but it's required for billing purposes. And we will send you the link. We can walk you through how to do that. They will just put in, their personal information, that this will become a number that they will always have. It's their number, but we would need that for billing purposes. It's how they determine who actually provided the service. For example, if you go to the ER, they have lots of doctors in there, but there's one doctor that wrapped your finger up. I smashed my finger a couple months ago. So that one doctor that smashed my finger up, his provider number is attached to my claim, even though they have lots of other doctors. They want to know who actually provided the service. So the lifestyle coaches are actually providing the service, which is the class. So they all have to have a national provider identification number. We ask you to complete the necessary paperwork with the CDC. For example, there is like a 3-page document that they want to know your organization is already recognized, and we can walk you through that process. And then your organization would be kind of attached to the hub. So we would be able to see all your reporting. We would do your reporting on your behalf. You don't have to do any more evaluation reports because we can generate those reports from Weld. So we would have access to all of your CDC reportable information. We ask you to contract with the hub's vendor, which is Weld. We have our master data sharing agreement, because you're entering information to a system that we also have access to. It has people's personal information in it. We have to have a master data sharing agreement. And then complete any affiliate or business associate agreements. That really comes from legal with Marshall University Research Corp, which is the academic division, and Marshall Health. So they all want to cover their butts, really. So they have all these legal agreements that they want you to sign. And if you have any assistance or questions about what's in those legal agreements, we can actually get a person to help you, because I do not understand what it's saying, really. The legal, it was stuck in legal for 3 years. I'm gonna tell you that. So just if you have, a legal person or somebody on your board that's good with reading the fine print, what does this mean? Please have them look over it. That helps protect your organization as well. And then we actually implement at least one class during this period. We have one organization, they really struggle. We know recruitment. You can recruit 10 people and maybe 2 people show up. But do you actually want to start a class with 2 people? So that can be a big challenge. So we just actually start at least one class during the funding period. So that would be one class before July 31st. Yes, ma'am, Sheila.
All I was going to say is that your NPI number, getting all of that and getting set up and everything is not going to cost you
Right.
anything. So, sometimes, and Regina is really great with sending all the paperwork, and Rachel is too. And so, it may seem like a whole lot. And especially when you start talking about agreements and things like that, but we just do it. And we help walk you guys through it. And so wherever you need to register or people you need to get in contact with. And then also, there are also these what are they held? It's workshops and things like that for questions. Like if you're having trouble with things, we encourage you, to sit in on any of those workshops and meetings and that type of thing. And of course, we're always looking for success stories and, anything like that you guys can share along the way. So, yeah.
That's
No
a great
upfront
point,
cost.
Sheila. And really, most of this infrastructure, you only do it one time. So once you do it one time, you don't have to worry about it again. So that's also a benefit. It's free, it doesn't cost anything. Maybe some of your time, we can help you through it. But once you get all this stuff done, you don't have to do it again. Other things we actually help us with is help us develop a sustainability plan. So the hub is really like a small village. We all share data. So one of the protective benefits of joining the hub is that it will help you maintain your recognition. So the hub has full recognition, which is required in order to bill Medicare. Any entity or organization or coalition that joins the hub, you also have full recognition automatically. And so because all of our participants are aggregate, you don't have to worry about, well, I need at least 5 people or I'm going to lose my recognition. So that goes away because all of our data is aggregate. So we got, a cohort of 5 people over here. We got 10 people over here. They add all those numbers together so we can maintain that recognition, not only for the hub, but all of the coalitions that are a part of the hub. So that's a good thing. And then we have monthly calls with the coalitions, our subsidiaries. Just want you to, it's peer learning, share what works for you. If you're having a hard time with recruiting and retaining people or want suggestions for marketing, we do help develop marketing materials. Share your lessons learned and barriers so we can all help each other move forward together.
Mhm.
And I already talked about completing that expense form.
Yeah, and I have one of the marketing materials that Regina and I have been working on. Regina's been working on a pretty cool little flyer. And so we're just developing that template, and then you guys can plug your own information in, or if you send it to us, we'll throw the information in there, your logos or whatever things that you want to like for your audience, for your cohorts, for recruiting those. And then we also have developed a prescription pad, which is pretty cool. So you can use that. So your providers, when that blood work comes back and they have people in their patients that come and they are identified as having prediabetes, here's a great, a lot of times if a doctor can write a prescription, a person is more apt to do what the doctor says with a prescription in hand. And that way it's a referral, actually. It's part of that referral process. And so that can kind of help you guys along. So, we can share that with you guys. We just welcome your all's ideas, and then we just go from there, especially in your affiliate meetings. And in fact, we'll even meet with you once a week if we need to do any more hand holding. So yeah, and you guys are comfortable with us. Most of you guys know we've been at this thing a long time, and so we're always available. Email, text, whatever. Just here to help.
And then you would just combine all that information into one document and email it to me, and we'll take it from there. And then I'll just open it up for questions.
Regina, you had said on there that the class has to be started by or began by July 31st. Is that right?
That's, that's really going to depend on submitting your application to Medicare, because what we learned through the process is that if you start a cohort before your Medicare application is approved, we can't bill for those participants. And it takes about 3 months to get that approved. So when we first developed this application, it was when was it? August? It was last year. So we had more time. So that may not be applicable because of the time frame, because it's already March. So even if you join the hub now, we would have to, everybody NPI number, do the onboarding through CDC, and then complete the application. Well, we need to add you to Kentucky's. We already have an approved application. We're not sure how long that process takes to amend and approve application. So when that gets amended and you're officially, on the application as a implementation site, then you can start a class so we can bill for those participants. So that may be subject to change. It is subject to change based on if we have to submit a new application to Medicare, or there's already an existing one we just need to modify. Great question.
Yeah. And we are just right now, the only billing that we've done has been for Medicare because we're bringing on other payers. What are we doing, Regina? One at a time, right? And we're starting with
Medicare Advantage, which we're
Yeah.
learning about. We don't have backgrounds in billing and claims, that we are learning that we have to contact each Medicare Advantage plan and contract with them specifically so we can bill that person or those couple of people in the class who have Medicare Advantage. And we learned this with Ashley, that most people don't know they have Medicare Advantage. You'll ask them, do you have Medicare? And they'll present their, red, white, and blue card. But lo and behold, the claim comes back rejected because they switched their Medicare plan back in December and forgot, well, it's, March. So now they have a new insurance plan. But that's, we're learning as we're going.
Any other questions, Regina, or for Vicki and Jennifer? April, are you still with us? You're in Brown County, Ohio. You guys do the DPP out there?
Yeah, it's done through AMRC, which is the hospital. We at the Brown County Health Department really don't have anything to do with that. It's just part of our diabetes coalition.
Gotcha. All right. Thank you, April.
You're welcome.
All right. Okay. Well, I have 102. We're 2 minutes past. And we will have a recording of this and give us a week's time. And then I'll shoot that out to you guys along with the PowerPoints too. And any other questions you guys might have, just shoot Regina an email. And I am still looking for an April presenter for office hours for this time frame. So if you guys have anything you guys want to get your brag book out about and talk about, or you think will be beneficial to the diabetes coalitions and healthy lifestyle coalitions in this rural Appalachia network that we all work in, shoot me an email and I'll put you on the schedule for April, which is the 4th Thursday of the month. Okay. So you guys take care and we'll be talking soon.
Bye, everybody. Thank you.
Bye.